Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about postpartum depression. So, having a baby is difficult, emotional, exhausting throughout pregnancy and postpartum, but it does put you at risk for something that's a little more than just feeling down or exhausted or tired. And I'm going to touch in some of the things to look for postpartum depression, but more importantly, I want you to have awareness of it. I want you to know that there are resources available for you, and that's what your staff, your provider, the whole staff network that you have, support system is there to help identify and to let you know if you have this. And that there is also, I'm going to mention, there's an exciting new treatment called Zurzuvae. So when you have a baby, especially your first, there's a lot of anxiety and nervousness. Do I know enough to take care of the baby? And you're getting yourself, being concerned about it is normal. Getting yourself educated, coming to videos like this is helpful for you. Your parents are going to love to give you information to be there for you as the new grandparents. So a little bit of nervousness is very normal. Also, sleep deprivation, it's tough. When you're sleep deprived, your moods will not be the greatest. You'll be a little more short-tempered or more emotional. That's pretty typical and normal. It gets better with time. It's tough the first month, especially if you're breastfeeding and you're the only one who can feed the baby. Very tough in the first 3 weeks. It gets better after the first month and gets even better after 4 months, but it can be exhausting and tough. But some people call this the baby blues, the emotionality, the exhaustion, the tiredness. It's certainly a time where, unfortunately, you take out some of that anxiety, nervousness, depression, and frustration on your spouse. So it may be a time where you both are nervous and anxious and you guys get at each other a little bit more. But if it goes beyond that, or it persists longer, if you're having harmful thoughts to yourself or to your baby, and doesn't have to be that extreme for you to have postpartum depression. If you're not able to function and do your normal things like take care of your own self, to clean, normal hygiene, take care of the baby, change the diapers, if you just feel hopeless or you can't get some of those things accomplished, that's something to watch for. And especially if it's lasting longer. The official diagnosis is after more than 2 weeks, but I don't like assigning a specific time period to it. For example, the newest medicine can be given up to a year after pregnancy and still be considered postpartum depression. So I want you to watch out for not being able to do the normal things. On the other hand, if you're watching an emotional commercial and you cry a little bit, well, that's pretty common. Or if you're a little bit, your fuse is a little bit shorter, again, with the sleep deprivation, you can ask my wife after a night on call, even with no new kids, I'm a little shorter too. We all are with sleep deprivation. So I'm going to give you and encourage you to look at some of the resources. There are national hotlines. Your provider will have all kinds of systems in place, social worker, questionnaires. They'll ask you a questionnaire to assess your mood, and it's called a depression scale. You want to be sure and get your follow-up, and there's no shame here. You want to get the assistance that you need, and also the nice thing about it, we recognize now that there is a specific hormone imbalance, and that's what this new medication called Zurzuvae is all about. And you take it daily for 2 weeks. It used to be an IV medicine that was really difficult. Now it's a pill. So you take it for 2 weeks, and most insurances are covering it, and it can work in days and have a dramatic effect. It does have a sedating effect. They're going to want you to not drive with it, and you have to take some precautions. So look into that. Just know that there are some new medicines, like, for example, let's say you had it before with a prior pregnancy and you're concerned for a new pregnancy. Are you going to have it again? Should you even get pregnant because of it? Well, that's pretty exciting that this medication is available. But I'll give you a link for that as well. But again, I'm not here to diagnose your postpartum depression nor am I here to tell you whether or not to take the medicine. I'm here to bring awareness to you, to know that there's a lot of information available, and encourage you to seek out help when you're really having a tough time, because there's much we can do. I hope you found this of use. Please leave your comments. Thank you.